The eFlow Rapid Inhalation System from Pari Pharma is an innovative device designed specifically to treat diseases of the respiratory tract and lungs. During its development, particular emphasis was placed on the patient's needs for a treatment method that is safe, fast, and above all efficient. We are pleased to provide you with this detailed guide to the most important components of your eFlow Rapid Inhalation System and their functions. The Nebulizer Handset. The Nebulizer handset consists of a medication reservoir and the aerosol chamber. The aerosol head. This nebulizes the medication liquid so that it can be inhaled. The inspiratory valve. With its two valve sections, the inspiratory valve controls the aerosol stream when the user inhales and exhales. The medication reservoir cap. This consists of the cap and the cap seal. The mouthpiece. The expiratory valve is already fitted to the mouthpiece. The control unit. This controls nebulization and provides you with information about the progress of the inhalation session via the display. The connecting cord links the control unit and the nebulizer handset. Your eFlow Rapid comes with an international AC power adapter. The easycare device is a special cleaning aid for the aerosol head. Your eFlow Rapid comes with an international AC power adapter. To change to the adapter for a specific country, slide the respective adapter from the bottom upwards and attach the replacement until it snaps into place. Connect the power adapter connector to the control unit and plug the power adapter into the main socket. The system is also designed to run on batteries. This allows you even greater freedom as to where and when you can use your eFlow Rapid Inhalation System. The battery compartment is designed to hold 4 AA 1.5-volt batteries. Please pay attention to the polarity when inserting them. The control unit can also be operated using standard commercial rechargeable batteries. The device package also includes the instructions for use of the eFlow Rapid Inhalation System and the easycare cleaning aid. Please read and follow these instructions. Proper assembly of your eFlow Rapid Inhalation System is essential for successful treatment. First, take the nebulizer handset. To open up the medication reservoir in the aerosol chamber, lift up the clip on the reservoir. There is a very sensitive membrane in the middle of the aerosol head. You must not touch this. Otherwise, the tiny pores in the membrane may become clogged. Hold the aerosol head by the clips on the sides and insert the two metal connectors into the slots on the medication reservoir. You will feel the aerosol head click into place. Position the inspiratory valve flush with the edge of the aerosol chamber. The two valve flaps must be lying flat. Please make sure that the valve is not inserted the wrong way round. The inspiratory valve must lie flat against the edge of the aerosol chamber, and the two valve flaps must also lie flat and be free to move. Push the aerosol chamber and the medication reservoir together until the opening on the reservoir engages in the clip on the aerosol chamber. Fasten the expiratory valve into the slot provided for this purpose on the mouthpiece. Attach the mouthpiece to the connector on the aerosol chamber with the expiratory valve uppermost. Attach the nebulizer handset to the connecting cord using the hinge of the aerosol chamber as a guide, and then roll the connecting cord upwards. Your nebulizer handset is now assembled and ready for use. Pour the quantity of medication prescribed by your doctor into the medication reservoir. Make sure that the medication does not reach a level higher than the upper scale marking. It is very important not to overfill the device. Attach the medication cap by holding it with the small opening facing upward and pushing the cap seal up onto the 4 engaging holes until it snaps audibly into place. Press the cap down gently and twist it clockwise as far as it will go. The closing mechanism is functioning correctly if the cap seal moves upwards as it is turned and is flush with the top when closed. Finally, link the nebulizer handset to the control unit with the connecting cord. Before starting an inhalation session, take the mouthpiece and enclose it with your lips. Press the on-off button on the control unit to start generating the aerosol. The green LED lights up and an audible tone is emitted to indicate that the system is functioning as it should. The function display varies depending on the operating mode. In the event of a malfunction, instructions for identifying and correcting the problem will be displayed here. Sit in an upright and relaxed position. This helps to make inhalation easier and improve deposition of the medication in the respiratory tract. Breathe in and out as deeply and calmly as possible through the mouthpiece. You must keep the mouthpiece in your mouth even when you are exhaling. Please do not breathe through your nose. Talk to your doctor if you feel you need to use a nose clip. Holding the nebulizer handset incorrectly can impair the quality of the inhalation treatment. Always hold the nebulizer handset horizontally to allow the device to work properly. The pause function allows you to interrupt the inhalation session briefly without having to shut the system down completely. The pause function can be used after the device has been running for at least 5 seconds. To activate the pause function, press the on-off button for about 1 second. The LED will flash green when pause mode is active. To resume your inhalation session, press the on-off button for about 1 second again. Complete the treatment session in the normal way. The eFlow Rapid Nebulizer handset must be cleaned and disinfected before it is used for the first time. All parts of the nebulizer handset must be cleaned of medication residue immediately after each use, and the system must be disinfected at least once a day. To do this, disassemble the nebulizer handset into its individual parts and place them all on a clean, absorbent surface. Disconnect the nebulizer handset from the connecting cord and take the mouthpiece out of the connector on the aerosol chamber. Take the medication cap off. Press the seal out of the bottom of the cap. Lift the locking clip on the aerosol chamber to open the nebulizer handset. Gently depress the clips on the sides of the aerosol head so that it can be disengaged from the medication reservoir. Remove the inspiratory valve from the aerosol chamber. For cleaning, place all components of the nebulizer handset and the aerosol head in warm tap water at about 40 degrees Celsius with a little dishwashing liquid for 5 minutes. Afterwards, rinse all parts thoroughly in warm running tap water. It is very easy to disinfect the disassembled parts of the nebulizer handset. To do this, you can use a standard commercial steam disinfector. Alternatively, you can place the individual parts and the aerosol head in boiling water for 5 minutes. Please only use distilled water for this. To dry the parts, place them on a clean, absorbent surface. Allow the parts to dry completely and keep them in a dry, dust-free place. The easycare cleaning aid is designed to make it easier for you to clean and take care of the eFlow aerosol head. Additional cleaning should be carried out not more than twice a week in exceptional circumstances only. To open it, gently press the pressure points on the side. You must be able to feel the aerosol head click into place. Link the connecting cord to the easycare cleaning aid and plug it into the control unit. Pour the 0.9% saline solution into the funnel opening until it reaches the mark. To start cleaning, press the on-off button on the control unit and keep it pressed until you hear a tone. Cleaning takes about 10 minutes. The control unit switches itself off automatically. Disconnect the connecting cord and remove the aerosol head. Rinse the cleaning aid out with warm tap water and dishwashing liquid. The control unit display will provide useful information in the event of a malfunction. The instructions will appear in flashing mode, then the device will switch itself off. The batteries are flat. Insert new batteries or run the device using the power adapter. Cable connection to the control unit or cable connection on the nebulizer has been interrupted. Check the cable connections. No medication added. Fill the medication chamber with medication. Inhalation interrupted. Resume inhalation by restarting the device. Battery low. Have fresh batteries ready or connect the device to the mains with the power adapter. The following information may be displayed when you are using the easycare cleaning aid. Battery low. Have fresh batteries ready or connect the device to the mains with the power adapter. Out of cleaning solution. Add 0.9% saline solution and restart. If you still have unanswered questions about your eFlow rapid inhalation system and how to use it, please read the comprehensive instructions for use of the eFlow inhalation system and the easycare cleaning aid. Please note that the nebulizer handset is intended for use by one patient only. The nebulizer handset components should not be used by more than one patient.